Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. This is your host, Andy Curry. Welcome to the show today. I am excited to have with me on the line Dr. Paul Casey, who is an ophthalmologist out of Las Vegas, Nevada. Dr. Casey has been in practice for 20 years. His schooling was done, first of all, at the University of Miami, the School of Medicine, then at the David Grant Medical Center, where he did his internship, and his residency was done at Wilford Hall Medical Centre. So, Doctor, welcome to the program.
Thanks, Andy.
Now, did I get that right on your education?
Yeah, those were the places that I went to learn to do what I do.
Okay. Well, the reason I ask is sometimes I can't read my writing, and I want to make sure I said it correctly. People think that I'm a doctor.
You can't read my writing, that's for sure.
Yeah, people think I'm a doctor just because of my writing, but if they got to talk to me, they knew I wouldn't be. So, anyway, let's talk about your practice. Tell us who you're helping, the kinds of things you do, what's your specialty, and that kind of thing.
Well, an ophthalmologist is a medical doctor, so we go to medical school. We specialize in the treatment, both the medical treatment and the surgical treatment of diseases of the eye and the tissues around the eye. And there's a lot of problems. Probably the most common problem that we ever run across is cataracts in our older patients. And we will also treat people for refractive error like eyeglasses and contact lenses, and we do laser vision correction. Many patients suffer from glaucoma or droopy eyelids and a variety of other diseases of the eyes and the tissues around the eyes. So there's no shortage of people with eye problems, and we are the ones that take care of it.
In your practice, now you listed a lot of things that you do, but are you specializing in a particular thing in the eye? And if so, what is that?
I think that really my concentration in our practice is a practice that's affiliated with a number of other groups with specialist surgeons in various fields of expertise. I concentrate primarily in laser vision correction, correcting the refractive errors of the eye so that patients can see clearly without needing glasses or contact lenses, and in especially refractive cataract surgery. Nowadays, cataract surgery is a procedure that no longer it's just get the cataract out and put a lens in and then give the person a prescription for glasses. Nowadays, we treat a cataract surgery like a refractive surgery, and we correct the vision while we're at it. So both of those two areas, both the treatment of younger patients with, say, LASIK surgery, and then the older patient with cataracts, with refractive cataract surgery, is sort of what my emphasis is.
Okay. So on the cataract surgery, you're still taking out the clouded lens?
Yes.
Okay.
So that's what a cataract is. A cataract is when the lens inside the eye gets cloudy. And, along the way, too, people sometimes forget, but the lens gets stiff as well. People, even if they don't need glasses, they need reading glasses when they get to be about 45 or 50. So that's a problem because, you live your whole life, you don't ever need glasses. The next thing you know, you got these granny glasses on, and you're cheaters or readers, or your arms aren't long enough, all that kind of stuff. And with modern-day cataract surgery, we can really fix it all. We can treat astigmatism and nearsightedness and farsightedness and take the cataract out. And also, we have lens implants that can give both the near and far vision back. So we really treat that cataract patient comprehensively and from the standpoint of a refractive surgeon.
Wow, that's interesting. I never heard that before. Is that fairly new or not?
It's been constantly evolving over the years, but in modern day, we have some pretty cool tools to use. We kind of were waiting for a number of years for those tools that we use in laser vision correction to come into our field in the cataract realm. specifically what are called femtosecond lasers. It's a laser that can make these incredibly precise and accurate incisions. So modern-day cataract surgery, as I perform it, involves programming a laser to make all the cuts that need to be made, the cuts that treat the astigmatism and the incisions that will allow me access to the eye, and the incision that allows me access to the cataract, and it even cuts the cataract up into a bunch of little pieces, so it's very easy to take out without inducing as much trauma as you would have to do it without the laser. So laser-assisted cataract surgery really helps to aid in the accuracy and precision of the results, which therefore makes refractive cataract surgery more of a realistic treatment option. We really get LASIK-like results in our cataract patients. So it is an exciting time, and you know, these various different tools have been evolving and coming on board, not all at the same time, but over the years it's just been getting better and better.
That's fascinating. I can remember sitting with my dad, my dad passed away about 10 months ago, and he and I used to talk a lot about different things, and he used to mention his mother, when she had cataract surgery, she had to lie in bed with pillows on both sides of her head for 2 weeks and just lie there.
Yeah, that was standard of care. I mean, back in the day, there would have been no operating microscope for that case. It would have been done with magnifying loupes like eyeglasses, strong reading glasses, and the cataract would have been all removed in one fell swoop through a large incision. She probably had no intraocular lens placed at all. You know, and that wasn't really that long ago, maybe 30 or 40 years ago. That would have been sort of the standard of care. But we've had a number of advances, with the laser-assisted cataract surgery being probably the most recent breakthrough. It really makes the surgery probably safer in a way, or certainly more accurate and precise, the way that the surgery is controlled through using the laser to make all of the incisions. And, you know, it's kind of a pleasure to me to do it that way, because I like doing things the best way possible. So it's a natural evolution in the surgical technique. I think, you know, I think all the specialties are getting more and more amazing. I hear there are new knee replacements that kind of flex forward and back, but they also go side to side for the skiers and stuff like that. So more and more medicine and surgical procedures are trying to do more to not only replace the tissue, but replace it in a functionality that it's supposed to have. Mm-hmm.
Wow, that's fascinating, and thank goodness for that. You know, that like dentistry has come a long ways too. That, you know, just these new findings and techniques and procedures and stuff. We're lucky to be in this time, I think, to experience that. Now, the laser, when the laser hits the eye, does that hurt at all? Is that painful?
No, we're able to numb the eye completely with eye drops.
Okay.
So that the laser is completely painless. Kind of like if you had a cut that was being sewn up and they injected it with an anesthetic, you don't feel a thing.
Okay.
So the laser is painless. It sounds painful.
It does sound
but
painful.
It's not. No,
now,
we use numbing drops is all. You don't even need a shot. You know, you just put the drops on the cornea where the nerves are that would feel it if you didn't numb it. But we do numb it, so you don't feel it.
Uh-huh.
So it's comfortable and painless.
Okay.
Mm-hmm.
Now, when you correct vision for like an astigmatism, that's what I have, so I'm told. And I'm 53, so if I get that done, will I still need glasses for anything?
It does depend. If you have a lot of astigmatism and you really just want to get that corrected, there's a special lens. It's called a toric intraocular lens, for instance, and that can really do a great job to eliminate astigmatism, and that is that's a technique that we use many times. Now, if you want to get your near vision corrected also, then we would probably implant a multifocal lens to give you near and far vision and correct the astigmatism using a different technique, probably a second procedure, like a laser vision correction. So many times to deliver the utmost in care, you can't always do it with a single procedure. Sometimes you need to do more than one procedure. Now, if I don't know your age, and I don't really want to ask you, but younger patients can get astigmatism corrected with a laser, and then they get the near and far vision. But the older cataract patient, which is kind of what we were talking about, who has astigmatism, may potentially, if they want it all, and they want to see near and far and get rid of their astigmatism, and they need two procedures.
Okay. So to back up for a second, you said if it could be more than one procedure, so the second one could include implanting a lens, did you say?
Mm-hmm. Yeah. So we have these terrific lenses that are like bifocals. Like people wear bifocals as they get older, and they have one section of the lens that will enable them to see far away, and another section of the lens that enables them to see up close. And we now have if you will, a bifocal type lens that can be implanted inside the eye.
Wow.
Typically at the time of cataract surgery.
Uh-huh.
And then if you have astigmatism, that wouldn't necessarily be that also, so you may have to treat the astigmatism. Most of the patients, though, undergoing refractive cataract surgeries we've been discussing would have the laser-assisted cataract surgery take care of the astigmatism components.
Okay.
So patients with very high astigmatism sometimes need that special lens that I spoke about, that toric lens. If you really have an oblong cornea, then it might not be best to try to treat that with a laser, but rather put in a special lens specifically for the purpose of treating that high level of astigmatism. And generally in those patients, I would advise them to go that route, because people with high astigmatism, well, that's a special thing, and you really would probably do better not to try to have it all, but rather accept the excellent vision that you get at distance with the treatment of astigmatism through the toric lens and then reading glasses after surgery.
Wow. That's amazing that you can put that is to me, I'm sure it isn't to you, that you can put a lens in and you can use it for bifocals and not bifocals. I've never heard of that.
Yeah. Yeah, many patients don't know it, and many patients are seeing doctors that might dabble in this, or they do one thing but they don't do another thing. So you really want to encourage your listeners to shop around and find somebody who kind of does it all and who treats their patients with passion, and someone who wants to educate patients thoroughly. I mean, the one thing about your grandma's surgery with the pillows is they didn't have to spend a lot of time talking about what they're doing, because they basically just did it one way. And nowadays, there are huge differences in the level of care that you might receive at one place or another, because there are so many things and they come along so quickly that it's literally hard for me to keep up. I have to take a week a month and just study or get trained or get credentialed on the newest, latest thing.
Wow.
But it's exciting, and I really enjoy what I do. I help people see better, and what could be better than that?
Absolutely. That's the gift of sight is an amazing thing. Where do you see, well, let me ask you this. You remember the $6 million man?
Yeah.
And he had the bionic eye. Yeah, Lee Majors. Do you ever see that happening in the future?
Well, it's interesting. There actually is the very beginning of that. Now, a bionic eye would really be the whole eye, and I don't see that anytime soon at all. But we do have the very beginnings of implants that are going inside the eye for blinding eye conditions, especially blinding retinal conditions, where researchers, usually at tertiary care facilities, UCLA or Bascom Palmer in Miami or some huge eye hospital, where they're putting in essentially like what's inside of a digital camera and then hooking that up to the optic nerve and trying to get some signals through the diseased retina that way. Mm-hmm. They haven't really accomplished good, precise, useful, valuable vision with that, but they actually have gotten some eyes that don't see to see at least a little bit. And that certainly is only going to continue to progress with improvements in the technology behind it. That's not something that I'm doing, but I'm keeping abreast of it so that if I run into a patient that may have that type of a problem, we can do it. I can tell you of another exciting advance in a special group of people that's really worthy of mention, and that is what's called the implantable miniature telescope. So in patients that suffer from what's called end-stage macular degeneration, not mild macular degeneration that a lot of people have where they don't see quite as good as they used to, but people who have really gone literally legally blind from this disease called macular degeneration or age-related macular degeneration, they would generally need to use magnifiers and telescopes and binoculars and things to make whatever they're looking at bigger so that they can see it, because their vision is destroyed to such a level that they can't make it out without that type of magnification. But these devices, when they're external, if you've ever looked through binoculars or looked through a telescope, it's kind of hard to see the world if you have to hold up a big piece of metal in front of your face.
Right.
Well, we now have a firm called Centrocyte that has miniaturized the telescope so that it can be implanted inside the eye at the time of cataract surgery. It's an exciting advance in the treatment of age-related macular degeneration, and the optics are far superior to these externally mounted telescopes. So we're real excited to start doing that for our patients with that condition.
That is astonishing. Never heard of such a thing. Well, doctor, thank you for joining us today. How can people, should they want to know more about your practice and you, how could they find that out?
I would recommend that they go to our website. Probably first and foremost, go to www.envisioncenters.com. They can also call our office directly. We're area code 702-388-2020. That's 702-388-2020. Or just Google my name. It's Paul Casey, MD, and they can find me that way as well.
Okay, and I want to clarify that Envision Centers, that's the letter N as in Nancy, so that's envisioncenters.com.
Yes.
Okay, well, doctor, thank you for joining us today and sharing with us your the stuff that goes on in your practice. That was really fascinating.
Thank you, Andy. I appreciate it.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.